A simple cough can sometimes turn into a dangerous lung infection called pneumonia, yet many people are still doing things every day that quietly damage their lungs and weaken their immunity. Pneumonia is an infection in one or both lungs caused by bacteria, viruses, or fungi, leading to fever, cough with phlegm, chest pain, and breathing difficulty. What is pneumonia and who is at risk? Pneumonia is more dangerous in adults over 65, children under 5, people with heart, lung, liver disease, diabetes, kidney disease, or weakened immunity, for example from HIV, cancer treatments, or long-term steroids, smoking, heavy alcohol use, and frequent close contact with sick people also increase risk of getting pneumonia or having a more severe episode. Habits and mistakes you must avoid: skipping recommended vaccines, not staying up to date with vaccines against flu, COVID-19, and pneumococcal bacteria leaves the lungs unprotected from key infections that cause or trigger pneumonia, especially older adults and those with chronic illnesses to ask their doctor about. Influenza, pneumococcal, COVID-19, and other recommended shots. Smoking and exposure to secondhand smoke. Smoking damages the tiny airways and defense systems in the lungs, making infections like pneumonia more likely and more severe. Quitting smoking, alcohol and drug misuse. Excessive alcohol weakens the immune system and increases the chance of inhaling saliva or vomit into the lungs, leading to aspiration pneumonia. Limiting or avoiding alcohol and avoiding sedative drug misuse to protect lung defenses. And overall health: poor hand hygiene and close contact with sick people, touching the face with unwashed hands, and staying very close to people who are coughing or sneezing spreads respiratory germs that can lead to pneumonia. Washing hands often. Avoiding touching eyes, nose, and mouth. And reducing close contact with people who are clearly ill, especially for high-risk viewers. Ignoring coughs, fever, and breathing problems. Continuing to work, smoke, or self-treat with home remedies when there is persistent cough, high fever, chest pain, fast breathing, or confusion can allow pneumonia to worsen. Urge to seek medical care promptly if symptoms are severe or not improving, particularly in young children, older adults, and people with chronic disease, poor respiratory etiquette, and dirty environments. Coughing or sneezing into the air, not wearing a mask when sick, and rarely cleaning high-touch surfaces increase spread of lung infection germs at home, school, or work. Covering coughs and sneezes with tissue or elbow, wearing a mask if around others. Regularly cleaning frequently touched surfaces. And improving indoor air quality. Weak immunity from poor lifestyle. Chronic lack of sleep, malnutrition, unchecked stress, and little physical activity weaken the body's ability to fight infections. Balanced nutrition, enough fluids, regular moderate exercise, adequate rest, and stress management as daily long armor against pneumonia. Poor control of chronic illnesses, uncontrolled asthma, COPD, heart disease, diabetes, or kidney disease increase pneumonia risk and complications. Regular follow-ups, taking prescribed medicines correctly, and action plans for lung conditions so that infections are treated early and recovery is faster.